And Norma, I heard you speak at a conference, and I believe it was an FASD conference, and I thought, Lord, our Savior has arrived. She is here. She gets it. And she's certainly so well respected in the world of addictions and mental health. And from what I hear, your employees won't leave. So everyone stays there for a long time. So that, that tells us something about Norma right there. I think what they told me was that she's somebody that always wants to make sure that they get honored for their work. It is my honor, Norma, to ask you to come up so we can present you with the Dr. Erin Frey Advocacy Award. Thank you for all that you do. We're in better hands. Come up here. Thank you for all you do. And the world is a better place. Our world is a better place. It really is. So,
well, this is so wonderful. I'm just truly honored and touched because I have so much respect for this organization and for Kathy and everything you have done. I was just saying to someone, I started in this field of addictions treatment purely by accident of getting a job in alcoholism counseling a million years ago, I won't even say when, at Cambridge Hospital, a newly formed alcoholism treatment program. And I began, this was in the early 70s, so I guess I can say when, and this was a new program at Cambridge Hospital, and occasionally a woman would trickle in, very, very occasionally. And they had opened a new alcohol detox center. And when the women came in, there was just flurry of kind of anger, anxiety. What do I do? They had nothing there for the women. It was just clear, so it became clear to me that something, and I came from a women's health movement to begin with, so I was very puzzled by this. I didn't really know a lot about addiction when I started in this field. It just kind of captured me in the early 70s. And so I started to think about doing some specific work around treatment for women and started a women's group. And I was saying to Ken, I actually started in developing programs with an NIAAA grant back in 1975, started one of the first women's treatment programs in the country. And from there, I just have learned so much about the stigma of this disease and how hard it is for women as mothers. Early in 76, 77, I don't remember exactly when when I first heard about FAS, because there were a lot of newspaper articles, there was some magazine, I just don't remember what the occasion was, but suddenly FAS was in the news. And we had a kind of an outpatient program as well as a residential program. We started getting phone calls, very frantic phone calls from the women some who we treated, others just women were calling us and saying, they had just heard about FAS, could they have damaged their babies, and they were just very, very concerned. And so I started kind of writing about the issues of the guilt that the women felt, and then learning much more about FAS. And so I have really tried. I'm very frustrated with the kind of lack of, and I talk about this in my state all the time, including to my state prevention director, with a lack of, I see prevention and treatment as one and the same, as circular, and that it shouldn't be separate. And it's so separate, whether at the federal level or at the state level, that I have tried very much to kind of put them all together by developing, really trying to move the treatment system to understand that this is a family issue, to look at the kids, to do more prevention work. And we have so many women in our treatment programs that nobody talks to them about alcohol use. I can talk from Massachusetts. Our epidemic right now, I put epidemic in quotes, is opiate use. And that the focus is, not that the focus shouldn't be, we have a lot of young people overdosing on prescription opiates, but nobody still is really raising the issues of alcohol. And so I'm just totally deeply honored. I just think the work that Kathy and NOFAS does is absolutely amazing. We've just finally got an FASD task force in our state. It took us 30 years or something, but we had some issues with some of our public health people who were worried that if we started a task force on FASD, we'd be asking them for money, and they didn't want, of course we are going to ask them for money. But they gave us permission to go ahead. It's a state task force. It's not from me. It's from the State Department of Public Health, which is the way it should be. And now we have a whole group of parents involved. We're just totally excited about that because to me, whether it's the birth parents or the adoptive parents, I am an adoptive mother of a young child, not young anymore, my youngest child, who doesn't have FASD but has some very serious learning disabilities. And it was, I've said this to other people, I mean, I'm very resourceful, I have resources, I know people, but raising her was like an eye-opener for me of what it must be like for parents to raise a special needs child. It just took, even though almost all of my time, and I was just, you know, it's nothing like when you experience it yourself. That is such a teacher for me. So I just have so much admiration for the parents and for the people who work in this field and for this organization. I want to thank you so much. And I just thank you so much. I'm deeply honored. Thank you.